CARF accreditation surveys fail on the same 10 findings. 10 to 15 personnel files, that's what surveyors typically pull. One gap in a single file reflects on your entire HR system. This is your CARF accreditation checklist: what surveyors evaluate, where organizations stumble, and how to prepare. We'll cover the 7 standards domains, the most common survey findings, and what it takes to keep the credential. First, what is CARF, and why pursue it? CARF International is an independent, nonprofit accreditor for health and human services organizations, founded in 1966. It has accredited more than 50,000 programs and services in over 30 countries. Decisions range from 3-year accreditation down to provisional, or non-accreditation. Here's why it matters. Accreditation increasingly decides who you can bill and who refers to you. Many managed care organizations, state Medicaid agencies, and commercial insurers require or prefer CARF accreditation as a credentialing criterion, and some reimburse accredited programs at higher rates. Hospital discharge planners, courts, and employee assistance programs frequently screen for accreditation status when routing patients. And organizations that rush preparation tend to receive more survey findings. A disciplined 9 to 12-month timeline improves outcomes. Organizations that rely on paper tracking for personnel files, supervision logs, and outcome data consistently struggle. Purpose-built behavioral health platforms like Behave Health are designed to reduce that manual burden. A well-configured EHR is designed to automate reminders for expiring staff credentials. Track individualized service plan timeliness instead of auditing charts by hand. And generate the outcome trend reports surveyors ask for, without manually compiling data before each survey. CARF evaluates every organization against 7 cross-cutting standards domains, plus program-specific standards for every service type you deliver. Here are the 7. Domain 1. Leadership. Surveyors look for evidence that the board exercises meaningful oversight and that strategy is data-informed. Key evidence: board minutes, the strategic plan, assigned ethics policy, and your organizational chart. Domain 2. Strategic planning, and it requires more than a document. Planning must be participatory, data-driven, and monitored against targets. Organizations that dust off the plan only when the survey approaches typically receive a quality improvement plan in this domain. Domain 3. Input from persons served, often the most differentiated domain for behavioral health. You must systematically collect satisfaction and outcome data, analyze it, share findings, and take action. Ad hoc feedback is not sufficient. Validated instruments commonly used include the PHQ-9, the GAD-7, the Audit-C, and the DAS-10. Domain 4. Human resources, a frequent source of survey findings. Surveyors may pull a random sample of personnel files. Gaps in any single file reflect poorly on the whole system. Every clinical role needs documented qualifications, current licensure, completed training, and supervision appropriate to the credential level. Domain 5. Health and safety. Emergency preparedness, medication management, and infection control are all evaluated, and plans must be practiced, not just written. Residential and inpatient programs face more intensive scrutiny here than outpatient programs. Domain 6. Rights of persons served. Surveyors may interview patients directly to check whether they understand their rights and know how to file a grievance. Paper documentation alone will not satisfy surveyors if interviews reveal a gap between policy and practice. Domain 7. Program-specific standards. CARF publishes standards for dozens of service types: detox, opioid treatment programs, residential treatment, partial hospitalization, intensive outpatient, and more. Review the standards for every program type you're seeking accreditation for. Requirements vary significantly. Survey findings cluster in the same places. Audit these before surveyors do. Outcome data not trended over time. CARF requires at least 2 data points for comparison. Personnel file gaps, missing reviews, unsigned job descriptions, lapsed license verifications. Supervision logs that record only dates without content, duration, and signature are generally insufficient. And patients who can't say how they'd file a complaint. An implementation gap. Earning CARF accreditation is the beginning of a 3-year quality cycle, not the end. Any findings require a written quality improvement plan, submitted within 90 days of receiving the survey report. Every year between surveys, you submit a conformance to quality report documenting ongoing improvement. High-performing organizations audit against standards quarterly and keep outcome dashboards current year-round. Stop handing surveyors the findings they already expect. See credential tracking, ISP timeliness, and outcome reporting in one platform. Book a 20-minute demo at behavehealth.com. Behave Health is designed to keep your documentation accreditation ready year-round. Book a demo at behavehealth.com.